could stick a patient and hook up some line on a machine and hook up some lines to a patient and let it run. But what about if you're pulling too much from the patient? What about when you have to do the calculations to know if you're pulling too much from the patient, because you could give them myocardial stunning in the heart, right? It has happened before, right? When patients, they pull too much from patients, and then this patient hypo, the patient finish dialysis, and as the patient get up and to go to walk out the doors because the patient faint away back, and you're seeing a pressure of 56/40, and you want to know what to do, right? But it's because you pull too much on the patient, right? But if you don't understand the theory, you can never understand your practical, because then you just be out there killing people. So I believe that's why Dr. Michael does be so hard when coming to marking, because it is people life. And yes, he teaches like if it's med students that he's teaching, because it's people lives, and it is a medical course. And after this course, you can always go on to do nursing and stuff like that. And let me give you a heads up, by doing this course, I wouldn't say to say is your last chance at Gates, right? Because it is a diploma and you still have a chance to do a bachelor's or a master's. And if you talk to Dr. Michael, he could just pull the right strings and you could get to go and do nursing or something higher once it's higher than the diploma. So there is never no hope. There never something with no hope. There is always hope, and there's always faith, and there's always belief, right? So don't feel like if you should give up, right? I always like to encourage people. It has nothing like giving up. It never have given up with me. I don't know if I sound like if I just crazy, but it don't have nothing like giving up with me, or feeling like if you're going and just forget about it. You ain't forgetting about nothing, because all that money done spend for you to come and do this course, and you have to pass. Simple. And we will pass. And we're going to go through this. This is why I even saying I'm going to do the extra day with the for extra class to the people that need any help extra. Right? So what you all think about that? Anybody feeling motivated?
Yes, I am. Yes.
Yeah, I had to people to, because it don't nothing like giving up, yo, right? I don't give up, right? And I'm not giving up on a list, so I like, yeah, come and want to come and say they're going and give up, right? We have to show
Yeah,
that,
but
Michael, that all right, no matter how hard you make it, you go
you
pass.
was making in the 80s. You
Yeah,
was
so
making 80s. So
you
you
could
know.
always go up. You could always go up. Even if you fail, you could always go up, because at least once you go up, it shows that you try. I saw some students, they make right on the brim at 70. You see the one, especially you see the ones who make in the 60s. Now that one hurt me a lot, because I was like, wow, wow, you know, how to make in the 60s, boy. Right, it's like like right there, and then it's just real simple mistakes. And if anybody wants to see over the paper, you could tell Dr. Michael, and he'll gladly show it to you. Anybody. And you will see where you went wrong, and he will explain it over where you went wrong, and he will even tell you what he wanted you to write or what he was expecting. Because I spoke to him and I asked him today, I said, "Sir, if the students want to see over the paper and they can see it over," he said, "Yeah, sure, tell them they can come and ask me, and he'll go through it with you." So anybody that wants to see over the paper and want an explanation, no problem, you all can go and you'll get it. Right? So I think I talk enough. We ready to start. It's
Yeah.
24 past 6. I have how many students here? 39. Okay. So I have asked you all to write an essay, right? But before we go into the essay writing, I think that we should start with little pieces, right? So the topic is peritoneal dialysis. So my question will be, what is peritoneal dialysis? So can someone tell me What is peritoneal dialysis?
Yeah, miss. Miss,
Is somebody going to talk?
go ahead, Tiffany.
Okay,
I'll
okay.
give it to her
So
because
is
nobody else was answering.
oh,
Who's going to answer?
Tiffany.
Okay, no problem.
oh gosh, I will talk and my mic was mute. Sorry. So what was the question? What is peritoneal dialysis? Dialysis?
Yes, just what is
Right. So it is
peritoneal dialysis?
right. So it is a treatment using kidney failure. You just use the lining of the abdomen, which is called the peritoneum, to filter waste products from the blood.
Nice.
That's all I have.
Tiffany, could you repeat that one more time?
The whole definition that I have.
Yeah. Yes, what you have?
I said that it is a treatment for kidney failure that uses the lining of the abdomen, known as the peritoneum, to filter waste products from the blood. In peritoneal dialysis, I think the peritoneum is the semi-permeable membrane.
Nice. Great. Anybody else want to give a definition on what is peritoneal dialysis? Or what it
Miss
contains?
Tiffany,
Yes,
read what we have right now.
Who's Kadira? I'm listening to you.
Okay. Peritoneal dialysis is a treatment used to remove waste products and excess fluids from the blood when the kidney can no longer perform this function. The lining of the abdomen, called the peritoneum, is used as a natural filter. A catheter is placed into the abdomen and the abdomen cavity is filled with dialysate. I have more, but I'll stop there. I have where the dialysate absorbs waste and extra fluid, which is drained after the fusion takes place.
Okay, so you're going good. Yes, that is peritoneal dialysis, right? And what it involves. Anyone else has another definition for peritoneal dialysis? Miss Jagan,
yes,
are you
miss.
online? Because I'm not even seeing a mic by you or a video stuff, so that's why I'm asking. Yeah, I know something is wrong. Yes. Okay, Miss Jagan, I see you there. On my side, I'm just seeing your name. There's nothing next to it, but next to everybody else's own, there's something next to it. Okay. So someone was going to give me another definition of peritoneal dialysis.
Yeah,
Yes, Miss Davidson.
peritoneal dialysis is a type of dialysis that uses the peritoneum in the person's abdomen as a membrane to which fluid and dissolved substances are exchanged with blood. It is used to remove excess fluid, correct electrolyte problems, and remove toxins in those with kidney failure.
Nice. So basically, what everyone just Miss Vangeline, okay, you wanted to say something? At the time that you were speaking, Miss Kadira was speaking, so both of your mic was on at the same time, and that's why I muted you. I didn't mute you for spite. I'm sorry.
Okay, so, that's okay.
Yeah.
Miss, I have
Yes.
that peritoneal dialysis is a process during which the peritoneal cavity acts as the reservoir, the dialysate acts as a reservoir, that the dialysate and the peritoneum serves as the semi-permeable membrane across which excess body fluid and solutes, including uremic toxin, are removed or ultrafiltrate. That's what I have so far.
Okay, no problem. Okay, so we know that peritoneal dialysis involves the insertion of a catheter into the abdomen and another catheter that goes from the abdomen to outside the body, right? There is a dialysate bag attached to the catheter, which is inserted in the abdomen, and a drain bag coming from inside the abdomen. And peritoneal dialysis also involves the transport of solutes and water across a semi-permeable membrane, which in this case is the peritoneum. So also we know that with peritoneal dialysis, the two fluid containing compartments are, in renal failure, the blood in the peritoneal cavity, right, which is in the capillaries, contains waste products such as urea, creatinine, and potassium, right? And the dialysis solution in the peritoneal cavity contains sodium chloride and lactates or bicarbonates and high concentration of glucose. I just mentioned this because I think that it should be mentioned additional to that the peritoneum serves as a semi-permeable membrane, you know. So do you all have that note or anything like that?
I'm not sure, but
Yes,
you could
I
repeat
do.
it, please.
Now this was just my note.
Sarah, you could repeat it, please. The blood
Yes, I'm going
contains
to repeat it. Peritoneal dialysis involves the insertion of a catheter into the abdomen and another catheter that goes from the abdomen to outside the body. There is a dialysate bag attached to the catheter inserted.
Miss. So long, we're trying to write.
Oh, it was writing. Okay, sorry.
Yeah.
So I'll call it sentence by sentence. Peritoneal dialysis involves the insertion of a catheter into the abdomen. And another catheter that goes from the abdomen to outside the body. Now, what I'm speaking about here is the basis of peritoneal dialysis, right? So I'm going to just start over. Peritoneal dialysis involves the insertion of a catheter into the abdomen and another catheter that goes from the abdomen to outside the body. There is a dialysate bag attached to the catheter inserted and a drain bag coming from inside the abdomen.
Miss, you can repeat it, please?
There is a dialysate bag attached to the catheter inserted, comma, and a drain bag coming from inside the abdomen. Peritoneal dialysis involves the transport of solutes and water across a semi-permeable membrane which the peritoneum serves as. Or you can put that peritoneal dialysis involves the transport of solids and water across the peritoneum, which serves as a semi-permeable membrane. So somebody could read for me what they have. Everybody on track? Just the ones who wanted the definition at the beginning.
I can read it.
Okay, I'm listening to Tiffany.
Peritoneal dialysis involves the insertion of a catheter into the abdomen, and another catheter goes from the abdomen to outside the body. There's a dialysate bag attached to the inserted catheter and a drain bag coming from inside the abdomen. Peritoneal dialysis involves the transport of solutes and water across a semi-permeable membrane, which is the peritoneum.
Nice.
And you were
So
saying
everybody,
something about the blood and thing.
yes, I'm going to continue, but I wanted to make sure that everybody understands that. So when I ask for the basis of peritoneal dialysis or what peritoneal dialysis is, right? Yes, you need to mention this because yes, it is the cleaning of the blood by using the peritoneum as a semi-permeable membrane. But remember, it is different from hemodialysis. So therefore, it's good to explain the catheter insertion part to the belly, right? Or to the peritoneum, to the abdomen. Everybody with me?
Yes.
Yep. Yeah.
Because we be coming here week after week and I ask if everybody understand and everybody say yes, miss, and then no, we having a big problem, right? So I want to make sure that everybody understand and everybody on the same track. So then we move on by talking about how peritoneal dialysis works, right? After describing that the catheter is inserted, you understand, and the drain bag comes from inside, right? We continue to describe more about peritoneal dialysis and how it works, right? So dialysis fluid containing glucose, right, goes into the patient's abdomen via the catheter. And dialysate solution comes in the dialysate circuit from the bag. And the blood circuit via the bloodstream.
Miss, could you repeat?
Dialysis fluid containing glucose goes to the patient's abdomen, goes into the patient's abdomen, right, via the catheter, which we have just explained, the catheter into the abdomen, right, via the catheter. And this dialysate solution and the dialysate solution comes in the dialysate circuit from the bag and the blood circuit via the bloodstream. Now remember, the peritoneum is the semi-permeable membrane, which is between the two. So what is the dialysate circuit? What is the dialysate circuit? So where the dialysate go in?
The peritoneum.
Nice. Right? And the blood circuit is the bloodstream. So that's why they say dialysate circuit. You have to think, right? Because they're talking about dialysate circuit and blood circuit. But what is the dialysate circuit in this case? Because with hemodialysis, we show it have an artificial kidney hook up on the machine, right? But in this case, we didn't have anything hooked up to any machine. So in this case, the dialysis circuit is the peritoneum, right? And the blood circuit is via the bloodstream because you know the blood coming through the capillaries, right? And the peritoneum is the semi-permeable membrane. Everybody with me? Everybody good on that?
Yeah.
Anybody need me to repeat? Everybody right?
Yes, Miss, could you please repeat it?
No problem. The dialysate fluid containing glucose goes to the patient's abdomen via the catheter, and dialysate solution comes in the dialysate circuit from the bag and the blood circuit via the bloodstream. The peritoneum is the semi-permeable membrane. The two fluid containing compartments is the blood circuit and the dialysate circuit, which is the peritoneum, and right? In renal failure, the blood in the peritoneal cavity, which is in
Sorry,
the
you can
capillaries,
repeat that last part, please? About the two circuits?
the two fluid containing compartments, right? Which is the dialysate circuit, which is your peritoneum, right? And the blood circuit. Because the semi-permeable membrane is their peritoneum. In renal failure, the blood in the peritoneal cavity or the capillaries contains waste products such as urea, creatinine, and potassium. So in renal failure, the blood in the peritoneal cavity or
Miss, you're going too fast.
in renal failure, the blood in the peritoneal cavity, which is the capillaries, the blood in the capillaries, right, contains waste products such as urea, creatinine, and potassium. Yes, I saw somebody said they want me to send it to the group. Okay, I have to type it up and send it to the group because I'm calling notes that I have wrote down, right?
Miss, you could send a voice note to it and people could just play it and write. It will be easier for you.
Yes, but I still want to teach it during class to make sure everybody gets it. But I will send it in a voice note, no problem.
Miss, urea, potassium.
And creatinine. The dialysis solution in the peritoneal cavity contains sodium chloride and lactate or bicarbonate. So the first thing that I said is in renal failure, the blood in the peritoneal cavity in the capillaries, right, contains waste products such as urea, creatinine, and potassium. Right? The next point that I said is the dialysis solution in the peritoneal cavity contains sodium, chloride, and lactate or bicarbonate. Also, a high concentration of glucose. The urea and
Basically, it contains the same thing as in the hemodialysis.
Yes, because that's the dialysate, right? Just like how in hemodialysis, you mix the dialysate, it makes the dialysate, and the dialysate is in the dialysate circuit, and then it have the blood circuit in the middle of the dialyzer, right? In this case, it's just that the blood circuit is the blood in the capillaries, right? So the blood in the capillaries that have all these waste products, and then yes, remember we are sending in this dialysate into a peritoneal cavity, right? So that's a dialysate circuit. So while this dialysate fluid is within there, right, the urea and creatinine will diffuse from the blood side to the dialysate side via this concentration gradient. And this is called what? Anybody could tell me? What is this diffusion from the blood side to the dialysate side via this concentration gradient?
Mr. Sorry,
Okay.
but there's the whole part I hear clearly.
Okay, so let me go back. Right? We were speaking about in renal failure, the blood in the peritoneal cavity, which is the capillaries, contains waste products such as urea, creatinine, and potassium. The dialysis solution in the peritoneal cavity contains sodium chloride and lactate or bicarbonate. Also, there is a high concentration of glucose, making this solution, I should say, hyperosmolar. HYPEROSMOLAI. AR, right? HYPEROSMOLAR. Hyperosmolar.
Miss, is it ultrafiltration by convective transport?
Not convective, not convective. The other, it is conductive transport.
Osmosis, Sarah?
Oh, yeah, excuse?
Is it osmosis?
Oh, it's conductive.
It's conductive transport. Yes, Miss Prince, it's conductive. So the urea and creatinine will diffuse from the blood side to the dialysate side via this concentration gradient, right? And this is called conductive transport. When we speak about ultrafiltration, ultrafiltration is the removal of excess water from the blood to be discarded along with the waste solutes into a drain bag. Water flows from the blood to the dialysate compartment via concentration gradients between the dialysis solution and the blood in the peritoneal capillaries. And also, did Dr. Michael tell you all about something called back diffusion?
Yeah, well, I read about it. Yeah.
It's in the handout.
Yeah, that's why you have to change the bags.
Yes, back diffusion when the glucose goes from the dialysate side to the blood side.
Blood side, yeah.
Yes. So there's also back diffusion. There's also back diffusion that takes place because remember that there's a high concentration of glucose. Nice, Miss Prince, right? There's a high concentration of glucose in the dialysate, right? That's why when I started speaking about the dialysis fluid, I said the dialysis fluid containing glucose enters the patient's abdomen via the catheter, right? So we continue to you see how everything comes into play. So when you're explaining, we need to try to explain as much detail as possible, because just by leaving out one or the other, right, it makes you miss marks. So it's a matter of pinpointing on everything. You don't have to write a million things about it, but it's just a matter of touching on the points of everything. So everybody with me.
Yes, miss.
Not everybody with me. 3 people with me.
Hello.
Yes, miss. Yes, miss.
Yes, miss.
Excuse
Yes,
me.
sir.
Yes. Someone
All
asked a question.
I am trying to ask a question. All this information have to go into the essay?
Yes, this is the basis of peritoneal dialysis and how the peritoneum is used during peritoneal dialysis. So the basis of peritoneal dialysis, is what it involves, right? What you have, so therefore you have to explain what peritoneal dialysis involves, which it involves the insertion of the catheter right into the abdomen, and then it have another catheter that goes from the abdomen to the outside of the body, right? And then there is the dialysate bag. So you have to explain because it's like you're explaining how it works right there. Well, the basic part of it by explaining it have how because how, even though you start to talk about, yes, is the dialysate in the peritoneal cavity, right? How the dialysate reaching in the peritoneal cavity, yeah, and how it's leaving from the peritoneal cavity. We know that the exchange have to happen and the blood have to clean, but how it reaching in there and how it's coming out from there. So you start by explaining that, right? That, you know, the peritoneum, the abdominal cavity is used. So the catheter is inserted into the abdomen. Then it have the other one, the another catheter that goes from inside the abdomen to outside the body, right? And then it have the dialysate bag attached to the catheter. So all this you have to explain because you're trying to give your examiner a picture of what is peritoneal dialysis. So by speaking about this, you're giving them a picture already in their head of how it's happening, how it's working, how this fluid getting inside the body to even start the ultrafiltration, diffusion, and this kind of stuff, right? So that's why we start off by speaking about the catheter insertion and the drain bag and stuff like that. And then we start by talking about the dialysis fluid and what it contains, right? And you talk about that the peritoneal cavity is used as the dialysis circuit, right? And the blood, which is the capillaries, is the blood circuit. You know, you have to explain these things. This is why I said, yes, you could write, but here is what you're writing.
Miss Excuse.
Yes?
Something I does when I do in my big question like this. Sometimes it does be plenty. So I just suggesting that some who have problem with writing plenty now. Take a jot down the important things, like how Miss say, right? So first what I does, I put the definition. So you must have your definition clear, right? What is peritoneal dialysis? You put the definition. So Miss talk about the drain bag, you put on the side of your paper, drain bag. You put solute and water. You put peritoneum, you put catheter. So while you're writing and you take a look at these words at the side of your paper, you're jotting it down, make sure you jot it down. So you'll remember that, okay, it have 2 catheters, one inside the stomach, one going outside the stomach, the drain bag. And this is how sometimes you will have all your salient points noted. So you will have to fight up to remember everything, but you're remembering the most important things, and then you're writing from what you have as you come down. And then when you check, you have 5 words or 5 or 6 words, you have 6 paragraphs.
Yes, because you elaborate. Very good, Miss Prince. That is a very, very great suggestion, right? Writing the points and then elaborating on your points.
Mm-hmm. That's what I just do sometimes.
Yes, but so it's a matter of being able to elaborate on your points. But once you have the main point, so that the person that's correcting the paper see that you know what you're speaking about. You have to let them get that picture in the head. Because if you just say that peritoneal dialysis is using the peritoneal cavity, as a dialysis circuit to exchange urea and creatinine in the blood because the kidney stop work. Now I am thinking about how this fluid reaching inside your peritoneum, man. So you have to give the person a clear picture of what you're speaking about, right? And then after I give them the clear picture of how this dialysate reaching inside the peritoneal cavity and stuff like that, then you continue to talk about how you're pulling the waste out of the blood, because that's the whole point, to clean the blood, right? And that is where you talk about the two fluid compartments, right? Where in the blood compartments, which is the peritoneal capillary, the peritoneal capillaries, yes, containing the waste products as the urea, creatinine, and potassium. And you talk about the dialysis solution that they put into the peritoneal cavity containing sodium chloride and lactate or bicarbonate. And you also have to remember to mention the high concentration of glucose, right? Making the solution hyperosmolar, right? You have to mention that because that is how the chemical exchanges will be taking place. It cannot have one without the other. So to the person that just asked the question, you understand? You could also message
Oh
me.
yes,
Look
yes.
at Miss
yeah.
Jolene. Miss,
Mhm.
are you Miss Reed?
Purcell.
Your name is not Miss Jolene Reed Purcell. You didn't send me an email,
Yeah, I
and
did.
I sent you back.
I
Did you check? Did you check
no,
the Google Docs? Because I edited it under your link, and I sent
mhm.
back an email for you saying that it is edited, so you can check your email.
All right. Okay. I didn't check my email
You
since
didn't
I
okay,
got home.
so you
Yeah.
can check it, and that is exactly what I was trying to explain to you,
Oh yes.
right? So
Yeah.
now that you are here, when you check your email, you'll understand what
Okay,
I was
I am
saying.
understanding exactly how it is. It's like you're giving instructions. So just by your essay, the person could actually set it up or visualize exactly what it is happening.
Yes, yes,
Right? It's like a little map, right? Yeah. Yeah.
yes.
I got it.
Right? So then you
Yeah.
continue by talking about the chemical reactions that take place, right? So somebody want to tell me how the urea and creatinine will diffuse? Via what? So the urea and creatinine will diffuse from the blood side to the dialysate side via what?
Osmotic gradient.
Yes, the concentration gradient. And this is called something transport.
Conductive transport.
Yes. This is called conductive transport, right? And can anyone explain ultrafiltration?
Miss, ultrafiltration
How ultrafiltration works? Yes.
is the movement of fluid under hydrostatic pressure from the blood compartment to the dialysate compartment.
Yes, but in this case, right? That's in hemodialysis. What is the hydrostatic pressure that's taking place here? So what is ultrafiltration in PD?
Can I read the answer?
Removal of excess water from the blood to be discarded along with waste solutes into the drain bag.
Yes, but how does it work? How does the ultrafiltration work?
From greater volume of fluid, some solutes are removed with greater volume of fluid removal.
Hello. Can I?
Yes.
Yeah. I want to read my answer. Ultrafiltration in peritoneal dialysis referred to the process by which excess fluid is removed from the blood across the peritoneal membrane by an osmotic gradient created by the dialysis solution.
Yes. And I read that, keep that you can keep that answer. Yes, it is. Right? So that was the closest thing that I heard, and someone else also said it, right? So a small note that you could take on ultrafiltration is that, and on how the ultrafiltration works is that, remember, dialysate contains high concentration of glucose as more water comes from the blood into the dialysate compartment via osmosis. The water dilutes the glucose in the dialysate compartment, right? Causing a decrease to the plasma osmotic gradient. So I will just repeat so the ones who didn't, or I'll probably read too fast. Right?
Yes, miss, I'm now gonna start to write.
So we understand that after a while with ultrafiltration is the glucose in the dialysate compartment will decrease and it will go to the blood compartment, right? And the glucose in the blood compartment will increase, right? Because in ultrafiltration, the dialysate contains a high concentration of glucose. And as more water comes from the blood into the dialysate compartment via osmosis, the water dilutes the glucose in the dialysate compartment. So that's how the ultrafiltration will work, right? So because they have a high concentration of the glucose, it will like suck the water because remember, that is ultrafiltration, the removal of excess water. So that is how the excess water is removed due to the high concentration of the glucose in the dialysate, which is in the dialysate compartment, which is in the peritoneal cavity. So we know that ultrafiltration is the removal of excess water from the blood to be discarded along with waste solutes into a drain bag. But we also know that ultrafiltration, right, it works because the dialysate contains a high concentration of glucose and more water comes from the blood into the dialysate compartment via osmosis, right? And the water dilutes the glucose in the dialysate compartment. So that's the whole osmotic gradient there.
And the water dilutes what much?
The water does dilute the glucose in the dialysate compartment. So there is a decrease. So it will end up with a decreased dialysate to plasma osmotic gradient. That's the osmotic gradient there, because remember the dialysate is full of glucose, and remember it's just like with sugar water, right? If you put two glasses, a glass with normal water and a glass with sugar water next to each other, and you put a hole in the middle, eventually the both glasses will have the same amount of sweet water, right? Because the glass with normal water, right, it don't have any sugar solutes in it, but with the hole that it have in it and the exchange that is going on, it will try to reach this equilibrium, just like in hemodialysis.
That is the example of the tea bag, yeah?
Yes. It is just pull out, right? And just
Somebody
by
in the waiting room.
as Yeah, Miss Toussaint, she's joining. Hi, good night, Miss Richards.
Yeah, good night.
I saw you join like 5 minutes. It was just marking
Yeah.
joining. I'm sorry.
Sorry, say again?
I said I saw you in the waiting room for like 5 minutes, and I have admitted you, but it was just marking joining.
Oh, okay.
Yes.
Okay.
Yes. So we have mentioned how the basic of peritoneal dialysis, right? With the catheter. So we explain how the catheter is inserted. So by explaining that, we explain how the dialysate enters into the body, right? And we also explain that there is the drain bag, right? And then we went on to talk about the dialysate circuit and the blood circuit, and we spoke about how the peritoneum is used, right, to transport the solutes and fluids during the peritoneal dialysis, which is through conductive transport diffusion, right, and also ultrafiltration. Right, and then we also mentioned that there is back diffusion, which is when the glucose goes from the dialysate side to the blood side, right? So with ultrafiltration, there is back diffusion, which is when the glucose goes from the dialysate side to the blood side. And we also know that after a while with peritoneal dialysis, the glucose in the dialysate compartment decreases and the glucose in the blood compartment increases due to back diffusion. So we know that this dialysate fluid is left within the peritoneal cavity for a while, right? And then it is drained. And just by explaining that, you could get 15 marks.
Miss, and in that part you could put in that is the dwell time.
Yes. So you're writing that, the dialysate, the dialysate is left in the peritoneal cavity, right? This is called the dwell, and the dwell is the time the dialysate remains in the compartment before having to refill the compartment with fresh dialysate. So what is the dwell? Somebody can tell me, give me the definition of what is the dwell?
The set
Miss,
time?
I know it. Miss, you know say it.
Yeah. I know say yeah. Yes. The
So
dwell
is
is
the period of time the dialysate is left in the compartment before it is
it has
changed?
to refill, yes, before it is changed, yes. Before having to refill the compartment with fresh dialysate. Right? And then the bag is drained. Right? And just by now, you say that is too much, but just by explaining that, that's like a little 10 or 15 marks question. So that's why you have to explain it like that.
Miss, what you could do, please, is you could give us the pointers in order.
Sure, no problem.
Like one word pointers.
Okay, Kadira, so you want me to go through it over again?
Just the pointers. No, you don't have to do the whole definitions and stuff, but you know, just the pointers in an order, like the blood circuit. Then what comes after that? Well, you will
Okay, no
know how
problem. I'll do it
to.
over now. Yeah.
Like a flow chart kind of
Yes.
thing.
Okay. So the pointers will be you mentioned what peritoneal dialysis involve, right? Which is the catheter. So you speak about the catheter, the insertion of the catheter, right? Then you'll talk about the dialysate drain bag, right? That is attached to the catheter. Next, we have to mention that peritoneal dialysis involves the transport of the solutes and water. So by mentioning the that peritoneal dialysis involves the transport of solutes and water, you will have to talk about the blood compartment and the dialysate compartment. Right? So you'll be explaining the blood compartment and the dialysate compartment and what it contains. So we know that the blood compartment, it contains the urea, creatinine, and potassium, and we know that the dialysate compartment contains the dialysis solution, right, which contains sodium chloride and lactate or bicarbonate. Also the high concentration of glucose, right? And this is hyperosmolar. Right, then then the next point will be the diffusion, right? Diffusion from the blood side to the dialysate side, which is the concentration gradient and also conductive transport. Next, we spoke about the ultrafiltration, right? What ultrafiltration is and how it works, right? And then we also spoke about back diffusion whilst we are speaking about ultrafiltration, right? And next, we talked about having a dwell time and then the drainage of the dialysate. And that was it. So that was the points. But I understand what you would like. You would like something like a flow chart. So I have to
Yes,
work on that.
yes.
Because I just have it write down everything here, scribbles. So
Because I started to write the essay, right? But my essay don't have half of these things, but it have the continuous ambulatory peritoneal dialysis.
Yes.
It have high transporters, low transporters, all them things I have in my essay, you know. But I don't have these basic things. So I don't know. I probably had to take out all them things I have.
But the basis of peritoneal dialysis and the way that that solutes and water is transported, right, that's with osmosis and diffusion, right? But when coming to CAPD and stuff like that, which is the various types of peritoneal dialysis and the transport characteristics, right, that they play, that's a total different something.
Yep.
Also, I don't think that I mentioned absorption.
No, miss.
Absorption is the glucose, where the glucose in the dialysate compartment is high after a while, and the glucose diffuses into the blood via the concentration gradient. Where that glucose in the blood increases.
So that will go before diffusion or after diffusion?
Not absorption, no, but absorption. ABSORPTION.
That will go before diffusion or after diffusion?
You can put it anyway once you mention the tree. After the, I think that's it, after that will be after diffusion.
Miss, so that is what
That's with back
the types of
diffusion.
transport you're discussing there?
Absorption is back diffusion. After back diffusion, right there, right? So the glucose diffuses to the blood via the concentration gradient after a while, right? Which means the glucose in the dialysate compartment will be high and glucose at the beginning, sorry, right? So the glucose in the dialysate compartment will be high at the beginning, and after a while, the glucose will diffuse into the blood via the concentration gradient. And this is called back diffusion, right? When the glucose goes from the dialysate side to the blood side, it's called back diffusion. So that is under absorption. Absorption of fluid, right, containing glucose via the peritoneal lymphatics, right? That's how absorption happens via the peritoneal lymphatics. So what happens in this is that the lymphatic system takes up the glucose-filled blood and transports it back into the body, right? So you know that once the glucose reaches into the blood, it's going back to the body, right? So this is the whole absorption process, right? When the lymphatic system takes up the glucose-filled blood and transports it back to the body. That's how the absorption process works. So you also have to mention that. That's just another point to add in. But right after the back diffusion, and then you can go ahead and you can also talk about the ultrafiltration, and that's it for that, for the basics. So that was the basics of peritoneal dialysis and how solutes and water is removed by using the peritoneum. Everybody with me? Anybody have any questions?
No, miss.
So I have 40 people online and nobody have any questions. Everybody understand. I know we just go through this
Yes.
every week, and then now remember, don't forget our position at the moment that we are trying to go up. So there's no shame in asking a question. There's no shame in messaging me and asking for extra help.
No problem. Oh God, Jesus.
Miss, I ain't got no feedback on my essay.
Who is this, Miss Tusa?
Yeah.
You sent me, that's not, I'm looking here. Oh, that's okay. I now see it.
If I could get a little feedback so I don't know what to work on and get it out of the way.
Okay,
Please.
yes.
Thanks.
Okay, so you're taking out that from, yes. Okay, I will message you. You're only using the top half of that, right? Because then you went off. So I see here. I'll message you.
All right, thanks.
Miss, you'll also give me a feedback on mine as well, and I'll be here.
Okay, Miss Pia, no problem. I'm looking through this now. So let us move on to discuss the various types of peritoneal dialysis and the reasons for their use, right? So what are the different types of peritoneal dialysis? I don't know why students keep getting bumped out.
Continuous ambulatory peritoneal dialysis.
And automated peritoneal dialysis.
And what is this? What is CAPD?
Continuous.
Continuous automated.
Yes, it is continuous ambulatory peritoneal dialysis. But what is it? Can I have a definition?
A manual exchange.
Fluid. Exchange of peritoneal fluid.
A manual exchange that is done 3 to 5 times a day with no machine necessary. Normal activities can be performed during or between exchanges.
And that is how long? What is the hours?
4 to 6 hours daily. 4 to 6 hours during the day.
Oh, yes, that is correct, Miss Prince. Sorry, my mic was muted and I was speaking.
I'm sorry.
Yes, that is correct, right? And what is CCPD?
Continuous cycling peritoneal dialysis.
And who uses this?
Person.
What is it? What is it? So it is a automated form of peritoneal dialysis.
Using a cycler.
Nice. Usually when?
Usually at night.
At night. Nice.
When the patient is asleep.
Nice. So where you all will get the two definitions, I don't know if you all have the same handout to me. I have a 26-page handout that mark peritoneal dialysis 1 and disinfection and maintenance.
Mm-hmm.
Yes,
right. So on that is page 2 of the handout where it have form of PD, right? 1 and 2. There's continuous ambulatory peritoneal dialysis, which is the exchange of peritoneal fluid 4 to 6 hours during the day, which is quarterly, right? And then we have 2, continuous cycling peritoneal dialysis, which is, someone could read it for me or tell me?
Usually done at night when the patient is asleep.
And it is an automated form of peritoneal dialysis using a cycler. And you have to write that it is an automated form of peritoneal dialysis, usually using a cycler, usually at night when the patient sleeps. Right? You're not just writing that it is done at night when the patient sleeps, you can get a half mark. Right? I missed out something. Okay, so it has what's the reasons for the use?
It's the automated peritoneal dialysis.
Yes.
Right.
What is the reasons for the use of CAPD?
Miss CAPD.
Anyone would like to answer?
Miss, what I mean, like the advantages of using it?
that what is the reasons for using CAPD and what is the reasons for using CCPD, because it's two different types of dialysis. So why can't a person why a person can't just choose to do CCPD or CAPD? Why
Miss
does it
it,
have two different ones? And it must have a different why I cannot just
Miss,
choose
it
any one.
depends on these capillaries, the size of the pores in the capillaries of the person.
Yes, but that is not
Because
quite what I'm looking for. But yes, you are correct at points.
Can I try?
Yes, no problem, Miss Reed.
CAPD more effective in patients with slow lymphatic reabsorption and solute clearance rate. And CCPD is for patients with high lymphatic reabsorption and solute clearance rate. And some patients can combine the both of them, the both methods.
Yes. So yes, so that is correct. With CAPD, CAPD is more effective in patients with slow lymphatic reabsorption and solute clearance rates. And with CCPD, patients with higher lymphatic reabsorption and solute clearance rates will use CCPD. So okay, so since we are talking about the lymphatic system, right? In peritoneal dialysis, what does the lymphatic system do? Anybody knows what the lymphatic system does in peritoneal dialysis? Because we need to get some thinking doing here.
Miss, the lymphatic system in
Miss, you sound
peritoneum.
like Dr. Michael.
Huh?
You sound like Dr. Michael.
No, but I just want to make sure that we are trying to break down things in much little points as possible. So the more small points that we go through, right, is the more that you will understand. So then when the exam reach, you have more to talk about and more to write about, because you remember all these little points that we went through and can say, hey, I could add in this here, I could add in this there, So what does the lymphatic system do in peritoneal dialysis?
Generally, the
Miss,
system is a drainage system, generally. So then
Yes.
it will have something to do with drainage and ultrafiltration.
Yes. That have
Miss,
something to do,
it
yes.
absorb. It help absorb. I write it down and I can't remember where I put it. Jesus Christ.
Anybody else?
I have
It removes fluid from the peritoneal cavity.
Yes.
I have the whole thing.
Okay, so I want one of the quiet students to answer me. Miss Priya Singh, are you online? I have never heard her speak in any of my classes, yet still you are always here. Would you like to tell me what does the lymphatic system do in peritoneal dialysis? Faith, you are online. Are you online? Wow.
It's gone.
I just had my participants dropped by asking those questions. So basically what the lymphatic system does, right, it's a drainage system, as Tiffany says, right? It's a drainage system that removes excess fluid from the tissues and returns it to the bloodstream. In peritoneal dialysis, the lymphatic system transports solutes like glucose, right? When ultrafiltration takes place and the water goes to the dialysate, the glucose from the dialysate will back diffuse into the blood as a result of absorption taking place via the peritoneal lymphatics of the peritoneal space. So yes, basically what the lymphatic system does is that it's a drainage system. That's it. But we all know that it always have a longer explanation for everything.
Quick question, Sarah, but is it also it includes like the organisms such as bacteria when it draining it?
Excuse that, Radha?
Yeah. Like it includes like bacteria and stuff when it draining it?
Yes, because the system does play a role in the clearing of fluid and debris, with including bacteria and protecting the peritoneal cavity from infection also. So you are totally correct. I like that you could have get that part also. So yes, it does that also.
So
Right?
Sarah,
Yes.
what
So
about
Miss does it. Oh, sorry,
Yes,
Tiffany.
Miss Prince, Tiffany,
Sorry,
talk, yes.
sorry.
Yes,
no
Tiffany.
problem, no problem. So what about so excessive lymphatic absorption? That's a thing.
It's
So
yes,
if it if it
it as
absorbing
if a lymphatic system damaged.
so then what would happen during peritoneal dialysis in that instance? Like what would
You obviously then your glucose in your blood will end up high, because then it will be continuously to start to over absorb glucose. I believe that something along that line will happen, right? I can
so
ask
then
Dr. Michael that question.
so then the fluid removal will be compromised. So then it could be like a failure then.
No, it wouldn't be that failure. It could be that you could remove if you leave the dwell too long, I guess that you could pull additional fluid, because then the lymphatic system tripping, right? So then you have like a extra ultrafiltration taking place. And probably you could pull too much fluid from your body. Just like how in hemodialysis, you could pull too much too.
So then what could cause the lymphatic system to malfunction in a sense? Sorry for
Tiffany,
taxing you guys there.
it's have Google for that question, because you asking me a scientific question. Yeah, I am not Gemini. I cannot answer that right now. But you could look up what causes the lymphatic system to malfunction.
Miss,
Yeah,
what does happen is generally, right, the lymphatic system does protect the body from
Yes.
diseases and viruses and bacteria and things. But I wrote down the whole thing and I don't know where I put the cue card.
I know.
But
So what I got here from Gemini was that the damage to the lymphatic system, right? It does make it's because of blockages, and it does have sometimes
right,
tumors
so
does damage
once
it, and
the
some
lymph
infections.
nodes, because the drainage will be through the lymph nodes, and once
Yes.
the lymph nodes is blocked, you find that your body will not absorb the glucose from the dialysate as it should. So that will cause
And
a problem.
you will end up with edema.
Right,
And
because
swelling.
yes, because
you're not getting proper
your lymph node,
ultrafiltration.
right, because your lymph node does help drain stuff. And we have several amongst our body, plenty lymph nodes over our body.
All over.
So I don't know if that might clear it up for her, but I had it right down and I don't know where to put it.
No, I will use Google for
No, but
Sarah thing. No, but I
Tiffany,
get what you're saying. Yeah? But I just wanted to know, like,
you wanted to know what could cause the lymphatic system to fail. What causes the lymphatic system to fail, right, is due to several factors, including the drain to lymph vessels, blockages from tumors or infections. Also, if you had surgical removals of lymph nodes, right, and also different medical conditions, like lymphedema, it could
Cancer.
contribute to a defective lymphatic system, right? And these issues, it will lead to a fluid buildup within your tissues and within your muscles, causing swelling, also although what we know as edema.
All right, all right.
Right? So what happens with so anybody could tell me what happens with low transporters? Can I have some students? I don't know why I have 38 students and I am only hearing like 4 or 5 students. What happened to the other students?
Miss, you want me to call out one of them?
No, Miss Kadira, I don't do that. I had 49 students online, and then from the time I asked to answer questions, students started logging out, right? I don't know why you all are afraid to answer. Okay, Miss Thompson, I see you online, and I know that you are a great student. May I ask you what happens with low transporters? I'm not hearing you. Okay, so Miss Thompson, I see your mic on, but I am not hearing you. Miss Sempa, are you online? So we have students
Miss,
that
I
are
can
just
answer.
online but not answering, no problem.
Low transporters have small capillary pores, resulting in slower solutes and fluid transport.
Yes.
Miss, I can answer it too.
Yes, because yes, they have more they could explain.
Low transporters tend to have smaller pores in the capillaries, so the transport of solutes and fluids are not as rapid as those in high transport.
Yes.
In the high transporter group, this means that dialysis sessions will be slower. A system in which solutes take longer to move should be chosen because low transporters will need a longer dwell time.
And that is totally correct, Miss Kadira, right? Because now what I have here about low transporters is basically almost the same thing as yes, Miss Thompson, I saw that you unmuted your mic and there was nothing happening, no activity. I wasn't hearing you, so I totally understand, but I know that you are here. Okay, so low transporters, yes, low transporters have smaller pores in the capillaries and the transport of fluids and solutes are slower than those in higher group of transporters. Right? A system with a longer dwell time is needed to be more efficient. Osmosis is longer, resulting in more water being able to be removed from the blood. Low transporters dialyze but ultrafiltrate well due to the fact that this process is less rapid than the high transport process. So what you said, Ms. Kadira, is correct. I just wanted to get out another definition so everybody that understand what are low transporters, can you just raise your hand, or will you all need it to be repeated for the ones that didn't get it?
Miss, could you repeat it, please?
Low transporters have smaller pores in the capillaries. Low transporters have smaller pores in the capillaries and the transport of fluids and solutes are slower than those in the higher group of transporters. A system with a longer dwell time is needed to be more efficient. Osmosis is longer, resulting in more water being able to be removed from the blood. First up. And someone, can you all tell me what happens with high transporters?
Yes,
Miss,
Miss.
I waited for somebody to get a chance, eh?
Miss, excuse.
Yes.
Miss, I'm leaving the meeting now. I have to go to work.
Okay, no problem.
All right.
Well, what we are going, okay, Miss Prince, what we are basically doing, we are doing low transporters and high transporters, right? And then the pitfalls. So you want me to message you? You want me to message you the topics when done?
Yes,
I can message. Okay,
all
no
right,
problem.
thanks, Mark. All right.
You're welcome, Miss.
Everybody have a good night.
You too. Enjoy your night at work.
Same to you.
Thank you.
So what happens with high transporters?
Miss, I could try again.
Yes.
High transporters have larger capillary pores, allowing for rapid diffusion of solutes. Dialysis is efficient, but ultrafiltration is poor due to less time for water removal.
Great. I really like that short, sweet answer that you have, Miss Ramjan. Anybody else have anything different? Because yes, because high transporters is exactly the opposite of low transporters, right? So anyone has any and any other definition for high transporters? Would you all like me to read a
Miss, I could
definition for
try.
you? Yes, Miss Richards, no problem.
It refers to how quickly solutes like urea and creatinine and water moves across the peritoneal membrane.
Miss Richards, you can repeat that, please?
It refers to how quickly solutes like urea or creatinine and water moves across the peritoneal membrane. I don't know if
Yes, it is that, right? But you have to make sure and mention that the high transporters have large pores, because large pores in the capillaries, because that is the reason for the rapid movement of the solutes, you know, across the membrane. You understand where I'm coming from?
Yes, Miss.
So together with that, you have to add in that high transporters have large pores in the capillaries, and solutes can diffuse rapidly from the blood into the dialysate. There is a shorter time for the fluid from the blood, right, to ultrafilter into the dialysate due to the rapid process, right? So the reason for the shorter time is why?
Because of the pores, how big the pores are.
Right.
Transporting faster. Yeah.
Yes, right, and the reason for because remember with the low transporters, them need a longer period of time because the pores in the capillary is small, right? So them need longer time, but with the high transporters, the pores in the capillaries big, so them need a lower period of time, dwell time, right? Solutes go through quickly, but so too does the water from the blood. So that is why they need a shorter dwell time. high transporters dialyze well, but ultrafiltrate poorly. And why is this? Why do high transporters dialyze well, but they ultrafiltrate poorly? We just said it. Why do high transporters dialyze well but ultrafiltrate poorly? So they said that
With
the
the
low
left hand,
transporters does ultrafiltrate well, right? Why does the high transporters dialyze well but ultrafiltrate poorly?
Because
The
of the
fast,
pores and
because
yeah,
of
the
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 large
speed.
pores.
Yes, because of the pause and because remember the more time you have, the better ultrafiltration, right? But the less time you have, the less ultrafiltration that you get. You understand? So it have to do with the time also. And yes, the pause.
Yes, I have what she said. I just have one line besides that, which is that automated peritoneal dialysis is more suitable for these type of patients.
Yes, high transporters is suited for an automated peritoneal dialysis procedure. That is correct.
I have a question again.
Yes, Tiffany.
So, how do you determine if a patient is a high transporter or low transporter? How you determine that?
Rapid answer.
Yeah, yes, it's
The
good
PET test.
answer.
PET test.
Yes, the peritoneal. So, what is PET? Because a PET is something we can run through the
Peritoneal
yard.
equilibrium test.
Nice, nice. Okay. Yes. A peritoneal equilibrium test, right? A peritoneal equilibrium test is conducted, and that is how you does determine high transporters from low transporters. I have something
And
I'm
what does
looking.
the test involve?
Okay, so let me. I'm looking for my note on that. Tiffany, I'm looking for my
Okay.
note on the peritoneal equilibrium
Measures
test.
the dialysate to the plasma ratio of solutes.
Whilst we are looking for that, I didn't hear anyone mention nocturnal intermittent PD.
Miss, I can't remember reading that.
Yeah, I ain't reached there yet.
And tidal volume P or tidal volume PD.
We ain't reached there yet.
Almost from the notes, I have the PET, the peritoneal equilibrium test, determines how quickly solutes and fluid move between the blood and the dialysate across the peritoneal membrane.
Yes, I have the PET. I have that it works by measuring the rate of the substances like glucose, creatinine, and urea between the blood and dialysate circuit of within the peritoneal cavity. I didn't have the exact how they conduct the peritoneal equilibrium test. Yes, but you all also need to. Okay, so let me give you a quick definition of auto nocturnal intermittent PD. right? Because all this comes under types of peritoneal dialysis, right? So patients who suffer from severe back pain or large hernias do not tolerate a long daytime dwell. So therefore, NIPD, which is nocturnal intermittent peritoneal dialysis, is delivered in the night and the patient is left dry during the day. So like how that with the other dialysis with CCPD and every 4 to 6 hours and they have the dialysis within the cavity during the day, right? Patients that take nocturnal intermittent peritoneal dialysis, they only have it in the night, right?
Yes, I remember reading it now
And they
as
are left dry during the day. So when they say yes, so when they say they are left dry during the day, meaning that during the day they don't have anything within their abdomen, right? It only happens in the night. And there is also a disadvantage. The disadvantage of that is that the clearance of toxins is decreased with the loss of the continuous 24-hour process, right? Because remember, during the daytime they're not getting to dialyze. So therefore, it's like they're not getting rid of all the toxins that they need to be getting rid of, because only in the night time they are dialyzing. And with auto-tidal volume peritoneal dialysis, this ensures there is a constant presence of dialysate contact with the membrane. This maintains a more continuous exchange effect by leaving a constant amount of reserve fluid in the cavity by only removing a portion with each drain. A portion is drained and the tidal volume is drained. After this, another volume known as the tidal fill volume is instilled to bring the reserve volume up to the desired exchange volume, right? So the tidal volume does majority of the time be like half. So it's like you're draining half and you're leaving back half after the drainage, right? So I want you all to look up the nocturnal intermittent peritoneal dialysis and the tidal volume peritoneal dialysis, because those are also types of peritoneal dialysis. So basically, what we have CAPD, CCPD, ANIPD, or NIPD, right? And ATVPD or TDV, tidal volume peritoneal dialysis. Right? So you have 4 types of peritoneal dialysis that you all have to discuss.
Miss, these definition on page 2 in the handout. The definition for tidal volume peritoneal dialysis and the other one is on page 10 in the handout.
Okay, right. So it's on page 10 in the handout. Yes, it is. Yes, it is. And on page 9, they also talk about the load transporters. And also, well, everybody understands, everybody have all the topics and everything that we went through. Yes, Ms. Sukram, you were going to ask me a question. Sorry.
Yeah, what about urgent start dialysis?
You can't mention it. So what? Explain.
No, I saw it in the book. It is an option for patients with urgent or unplanned need for dialysis within 48 hours. This is patients who are referred.
It's like an emergency.
Emergency, yes.
Yes, it's like an emergency. That is. Yes, you can mention it also because it is a type of dialysis, but it's like in case it make sure you have to mention, if you mention that, you have to make sure I mention that it's in case of emergencies.
Yeah, only in life-threatening symptoms.
Yeah, like that. So there we did the basics of peritoneal dialysis and the different transport of the solutes during peritoneal dialysis, and then we discussed the various types of peritoneal dialysis, right? And when we use them, and also the role that the transport characteristics play, right? And just like that, if you answer those 2 questions, if you get it for exam and you answer it correct, you could have like something like around 30 marks, 40 marks. That's why I still just mention everything. Now this question, this exam number 5 is the easiest exam ever to me. Because it's peritoneal dialysis and you just learn everything on peritoneal. See your handout, make the handout your friend. That's the handout of peritoneal dialysis. So we have 4 more minutes to 8 o'clock. So do you all want to stop, or do you all want to go through the complications of peritoneal dialysis?
We could probably go through. We do any classes from this Saturday that confirmed or no?
Excuse?
Yes, I don't mind.
The extra class that you was asking us about, Sarah.
Yes.
That confirmed or not? We doing it from this Saturday.
It's confirmed
or...
if you all want it. So I'm going to have the extra class on Saturday. That will be like, it can be for 3 o'clock or it can be for 4 o'clock.
So from this Saturday?
Not from this Saturday, only on this Saturday. It can either happen on Saturday or Monday. You all said that it will be better to have it on Saturday, right? So it will be like around 3 o'clock, or either 3 o'clock or 4 o'clock. I will have a vote on it in the group. So then the best vote wins.
Sarah, good night.
Yes, good night, Mrs.
I am very much interested. However, most Saturdays I just have to catch a boat to return to Tobago.
On Saturday?
Yes. Do you have any other day that's available? Most Saturdays.
It was a vote between Saturday and Tuesday. Sorry, yes, Saturday and Tuesday for an extra class, right? That's for this week, right? Yeah. So it was either Saturday or Tuesday for an additional class. So I will have a vote on it within the group. If you are coming to class on Saturday, I'll be there. So anybody who wants help, you can always ask me. I'll be there.
I'll be there on Saturday. But the online with Tuesdays may sound better for me.
Okay, no problem. So we'll have a vote on it on the group, and the day and the time with the most votes, we'll have it on that, right? Because it's due to the majority of the availability. But you know that you could always message me privately.
Okay, no problem.
Right? Nice.
Mercy asked the complications of peritoneal dialysis.
Yes.
I just saying what I wrote down, right? Perforation of major blood vessels or bowels. Due to, hemorrhage, sepsis, possible death. Infections, peritonitis.
Kudira, right there, you'll have to reword. I believe that you'll have to reword that statement as in the perforation of a major blood vessel or bowel after the placement of a catheter, leading to hemorrhage, sepsis, or death.
Okay, miss.
So you were correct. It's just a matter of the wording. Yeah.
Yeah.
So you continue. Nice.
Infections like peritonitis, exit site and fungal infections.
Nice.
Peritonitis,
Peritonitis. What else you said? Fungal infection. Exit
exit
site.
site and fungal infections.
And okay, nice.
Protein malnutrition because of peritonitis.
Yes, peritonitis can cause extreme protein loss.
Rapid derangements such as high LDL, low HDL, arteriosclerosis. It has something else, but I didn't write it in.
What is LDL and what is HDL? Like and high the like? What is HDL and LDL?
I'll just write the abbreviation.
Low cholesterol and high cholesterol.
Low
High
density,
density
low
lipoprotein.
density, yes, low density lipoproteins and high density lipoproteins. And also there's an increase in the triglycerides, right?
Right.
Nice.
That is TG, right?
Leading to atherosclerosis.
Right.
So basically there's an imbalance in the lipids. Nice. Continue.
Hyperinsulinemia.
Yes.
And hypoglycemia.
Due to?
Miss.
Yes.
Miss, you can finish it for me.
No, I'm not picking on you.
No,
I'm not picking on you, no.
I'm trying, so you have to help me.
No, right, okay. So right, you talk about the hyperinsulinemia and the hyperglycemia, right?
Yeah.
Due to the glucose in the dialysate, because remember the high glucose in the dialysate, that's going to make your, as we just say, your sugar go up, your glucose levels in the blood go up, right? And by your body trying to send down the glucose levels in your blood, then it will start to produce insulin. So that is why you will have hyperinsulinemia, which is a high level of insulin in the blood. Hyperglycemia, which is a high level of glucose in the blood. You understand? So this is due to the glucose, right? So it have a high level of insulin secretion, leading to hyperinsulinemia, which also leads to atherosclerosis, right? So the dialysate having a high level of glucose will lead to hyperglycemia, right? And the body will begin to lose glycemic control, right?
Okay.
So yes, that is why. And when you all writing your complications now, you see that you have the complications, right? It's just that you just have to add on those little parts to it, right? Given just an elaboration on what you already have. It's not that what you have is wrong. You understand?
Yeah.
Nice. So this is how we just get points, right? Remember, we're looking for points. So nice. So you can continue.
Hernia formation.
Why?
I didn't elaborate again. So
right. So why we get hernias? Anybody want to tell me how we get hernia? What is causing hernias? Tiffany.
Pressure.
Oh, Miss Carey is answering. I saw Miss Carey was speaking. Sarah Carey. So why do we have hernias? Miss Susa, I'm not hearing you.
The pressure from the excess fluid.
Nice, right? So yes, there is an increased intra-abdominal pressure from the installation of the fluid, right? So due to the large dialysate volumes, isometric straining, or yes, that is it, sorry. Due to the large dialysate volumes or the isometric straining, right, this of causes the hernia. And we also have the vascular maneuver, right? So due to the continuous pressure from the fluid, the dialysate fluid, this could cause hernias to arise. And what is the last point?
Inadequate dialysis due to impaired transport characteristics of peritoneal membrane.
Nice. Well, and this is secondary to what?
Peritonitis.
Nice. Great. And right there we have our seven complications of peritoneal dialysis, right? And you have 10 marks. So we know that we have to do the complications of peritoneal dialysis, right? Also there are pitfalls of peritoneal dialysis. So what are some of the pitfalls of peritoneal dialysis?
Inappropriate dwell times.
Right, and what do I mean by inappropriate dwell times, Miss Pierre?
Not happening enough. Miss, you know what? I don't know.
Yes?
I don't know. I feel I've said the wrong. I feel I said the wrong thing.
Yeah, just talk. You can just talk. It don't have nothing like the wrong thing. What is the wrong thing? Even if that's why we're here, we're trying to figure it out together. Right? So how you know if you have the right thing if you're afraid? It's nothing like afraid, nobody going and bite you. Even if you say the wrong thing, so what? Everybody here to learn. This is a learning process and it have no shame in learning. So yes, inappropriate dwell times due to what? What do they mean by
Not enough
inappropriate dwell
time.
time?
Not enough time spent in the not enough time spent. I don't know.
Yes, to put in the dwell. So inappropriate dwell time. So you're supposed to have in your dwell for 4 hours. You put in your dwell for 1 hour because you have to go out and you just rush this thing, right? So inappropriate dwell time. Simple. And I like another pitfall of peritoneal dialysis. Anybody?
Non-compliance with prescription.
Nice. And what is non-compliance with the prescription by the patient? What this leads to?
They might skip days for doing the dialysis treatment.
Ms. Davis, can you repeat what you said?
They might skip days doing the dialysis treatment, for the dialysis treatment. If it's every day, they might skip some days
Yeah.
from
Yes.
doing it.
Yes, they're not listening and they're not doing it how they're supposed to be doing it. Right. And what's another pitfall? Anybody?
Inadequate ultrafiltration.
Explain. And how it is, where do you see inadequate ultrafiltration?
Miss, when the osmotic gradient loss, where the fluid removal, it's not good. It's not doing what it's supposed to do.
The patient didn't put in the amount of fluid that they're supposed to put in
What I did is I
In
googled the icodextrin, and that's the result I get from that.
Okay, I understand that, right? But when we're talking about the pitfalls of PD, I want you all to use the pitfalls of PD that Dr. Michael has on the on page 4, right? So there are 6 pitfalls. There are 6 pitfalls in peritoneal dialysis. If you all could remember 5, that would be great, right? So we have the inappropriate volume. I heard somebody say that where the patient may instill 2 liters of a 2.5 liter bag, right? Also, how they will say is they're trying to save dialysis. So they say, huh, wait, but I will just use 1 liter today instead of a 2 liter. So
But
the
Miss D, thing I
inappropriate
just
is
answered, look at here in number 4.
it's on page 4 in the handout, pitfalls of peritoneal dialysis.
Right, it's number 4, the inappropriate instilled volume.
Yeah.
Sorry, inappropriate selection of dialysate osmotic agent. The ultrafiltration and
Yes,
the
that's
clearance.
number 6.
Right.
Yes. For long dwells, and that leads to a decrease in ultrafiltration and clearance. We are missing one more.
The
2.
multiple
rapid
exchange.
Yes,
Which is
and
how the clearance of solution from the blood.
excuse?
Is it how it clears small solutes from the blood?
What is that?
Is that with the multiple rapid exchange?
No, that's one will have to do with number 6, the clearance. Well, the multiple rapid exchanges, that is like, okay. Let me see the best that I can explain that. Like, okay, the patients, they know they have to do 6 hours for before they do an exchange. Let me say they have to do 4 to 6 hours before they do an exchange. They decide that, all right, I had to go and do something, so I can't really wait for this 4 hours. You know, I would just do 2 hours, and then when I go and do whatever, and I come back, I will do a 2 hours again. So therefore, yes, that will be affecting the clearance also because they're not going to be properly dialyzing. And this is why plenty people with who on peritoneal dialysis is just dead real fast because they're just doing everything wrong, especially in Trinidad. That doesn't last long. And people that choose peritoneal dialysis because you can do it at home, but majority of the time it just doesn't work out. You understand, Ms. Pierre? And we didn't mention number 3, the failure to increase the dialysis dose to compensate for loss of residual renal function. So sometimes the doctor tell you, well, all right, yeah, you have to, instead of using 2 liters, you have to use 3 liters, you're just saying, right? And you decide that, well, no, I'm not using 3 liters because, it probably less cost effective, or you have different reasons why. So you decide that you're not going to increase the dialysis dose. You understand? The amount of dialysis that you're going to take, or the amount of dialysis that you're going to use and stuff like that. And all these stuff will be affecting your clearance drastically. So anybody have any questions? Are your brains filled for this evening? Do you all want to continue, or we can stop there until next class?
Sarah, I'll be calling and harassing you a lot this week.
No problem.
Okay.
Tomorrow I will also have, I'll have some time on my hands, right? So you could have some communication with me tomorrow, and you feel free to message me tomorrow. Yeah. Yes, I will be at work, but I'll be having an easy day at work. So you can feel free to message me tomorrow anytime.
Thank you.
You're welcome. And Saturday I will be there in school, right? If you don't see me and you want to see me, you can just message me and I'll show up. I know you guys is there, you always see me when I come in the morning, but I just be right there around school, right? So if you all would like to see me for any assistance, I will be there. And you could just message me, I'll be there. Okay? So anyone has any
Thank you.
questions? Mr. Grant, I see that you are online and you came into my class and you stayed quiet all evening. It was nice having you though, Mr. Donovan. Okay, so everyone, as I said before, feel free to message, feel free to contact me for any help. I will type up the basis of the peritoneal dialysis and send it.
Okay,
Right.
thank you. Yes.